Hey everyone, it's Ryan Flynn with AIRX. I'm here with Jack Moore, who is the CEO and founder of Earshot Health.
Yeah.
Great. So I know I was just talking to one of your advisors, and I was really impressed with what you're working on, how it can help reduce patient readmissions for hospitals, how it can let people recover at home, and actually almost offer a more personalized approach to the feedback you get from the hospital system. So maybe you could tell us a little bit about what the company's working on, how it uses AI, and what it might mean for patients and hospitals and healthcare in general.
Yeah, there's a huge an army of people in the healthcare space called care managers, and what they really do is help people stay healthy between doctor's visits.
Mm-hmm.
This is all sorts of services around helping people get their medications, make sure they have rides to their visits, have access to food, connecting them with social programs, and they're unsung heroes in our health system insofar as they prevent hospital readmissions.
Yeah.
And it's a huge thing. It prevents you and me from paying tons and tons of money for unnecessary hospital admissions, and it also saves hospitals a lot of money, insofar as readmissions are really expensive from the perspective of a health system.
Right, right. I've seen some technologies come out this year or last year that work on language translation. This is an area where if the patient doesn't understand the English language, they might not get the right medication or take the right advice from the doctor. Do you have any way of kind of filtering or giving patients what they need in their own language?
Yeah, there are some really great studies out there that say that 80% of the information that a patient gets given during your average doctor's visit gets lost as soon as they get to the parking lot. And language is a huge part of that. The
Right.
language gap is a huge part of that. And one of the benefits of implementing AI, of having AI participate in this process alongside a really highly qualified human, is that the language barrier just goes away.
Mm.
We really reduce the language barrier. And with a lot of these programs, the economics of it are so tight for the companies and the healthcare professionals running it that oftentimes they don't have the ability to send meaningful take-home materials with their patients. They're
Right.
really strapped for time, and so AI has a lot of benefits in terms of closing that gap and making sure that patients have the resources they need to stay healthy.
And then with the at-home care, I think most of us probably prefer to be in the comfort of our own bed with our
Yeah.
family versus being in a hospital room, and it's also a lot cheaper for everybody involved, the healthcare system. And I also think too, with the healthcare system, people are so busy. All the people that are the care agents that might call you, probably glancing at a sheet with your details or documents, and they might miss something, not out of their
Yeah.
fault, but I would imagine that an AI system that has the ability to look through all your records has the ability to be a more personalized approach for that follow-up call or the care. How does that work?
Yeah, I wouldn't wish interpreting an electronic health record on my worst enemy. It's a rat's nest of information. There's so much that goes into our individual health data that interpreting it is really onerous.
Mm-hmm.
And so if you think about these care professionals, they're calling patients every day, keeping up with their health, and that task switching is really tough.
Yeah.
And so what our AI does is takes in all of the structured data, so your device readings, your test results, all those things, but also the information that comes across in the notes from your visits, right? That note from your doctor saying that your sister is the one giving you rides to your appointments. And those are really key details that often get missed.
Mm-hmm.
And so when that care manager asks, hey, is your sister available to take you to your cataract surgery next month? That's a really meaningful question to be able to ask people. It connects patients with their care, and it also helps close care gaps and make sure that patients don't miss that key surgery or
Right.
those sorts of things. Those are really important details that are really hard for us for you and I to glean in a meaningful amount of time.
Well, it's an exciting area, and I'm glad that you took the time to talk to me. And good luck for this year.
Absolutely. Thank you so much.
All right. Bye.